Welcome. The Moving Needles Project, which aims to improve immunization practices in long-term care, recently surveyed frontline staff working in settings that deliver post-acute and long-term care about immunization. This included certified nursing assistants, nurses, front desk, kitchen staff, and more. They were asked about how they view vaccination relative to their work. This video addresses 5 issues that frontline staff raised that you also may have questions about. Here's question number 1. Am I protected after getting vaccinated? Before a vaccine is licensed in the US, it must be proven to be effective. Some vaccines are extremely effective. For example, the measles vaccine is 93% effective after just 1 dose. Flu vaccines are generally 40 to 60% effective at preventing flu-related doctor's visits. That is, they lower your chance of getting sick enough to go to the doctor by about half. It's not a magic wand, but getting flu vaccine makes it less likely that you'll get sick at all, and if you do get flu, you probably won't get as sick. Question number 2. Will getting vaccinated cause some unknown side effect in the future? By the time a vaccine is approved by the FDA, it has been used for at least 3 to 5 years in humans as a part of research studies that are designed to identify side effects and how well it works. After vaccines go into use, there is a large network of overlapping systems monitoring vaccine safety to identify any concerns. Any potential concerns are investigated, and if confirmed by scientific evidence, it may change how a vaccine is recommended for use. One important thing to remember is that vaccines don't stay in your body. The ingredients help your immune system learn to recognize flu viruses. Then they break down and leave your body within days. There's no mechanism for them to cause delayed or hidden effects years later. Question number 3. Am I less likely to make others sick after getting vaccinated? Yes. For example, getting a flu vaccine can make you less likely to spread flu to others because you're less likely to get infected in the first place. If you don't get infected, you can't pass the flu virus to others. And if you do get infected, you tend to shed less virus for a shorter time, which reduces the chance of infecting others. These 2 points are especially important around older adults, people with weakened immune systems, and babies because these groups can get very sick from flu. A lot of frontline staff surveyed mentioned that they get the flu vaccine mostly to protect their family from the viruses they're exposed to at work. Question 4. Is it better to develop immunity by getting the disease or by getting the vaccine? Getting each vaccine is safer than getting the disease it prevents. Each vaccine is tested before it's licensed in the US. Some vaccines, such as HPV, provide better immunity than the infection itself. The main benefit is based on safety. Plus, getting immunity through vaccination doesn't spread the infection to residents, family, and co-workers. Question 5. Do doctors promote vaccination for financial gain? Most doctors do not profit meaningfully from vaccinations. Vaccines cost money to purchase, store, and administer. Insurance usually just covers those costs or yields a very small margin. Some practices report that vaccines create a small loss financially, but they offer them because it's important for patient care. Even the vaccine companies that do earn profits from vaccines, as they do from any medicine, typically have much lower profit on vaccines than on medicines taken daily. Staff also asked about individual vaccines, who they help and how effective they are, as well as about specific vaccine side effects. To learn more about this, see the COVID-19 and influenza videos on this dashboard and the vaccine handouts at www.movingneedles.org.